Coup. It is Monday, January 31st, 2022. Hope everybody's having a lovely day. Tina should be joining us if and when she could get her internet working. So stand by for Tina. Everybody smash the like button right under the live stream. The more people that press the like button, the more people that will see this. There's a lot of other things going on in the news, but to me, this could be one of the most important stories going on right now that the media is not covering. I'm joined by Amar Shergill. You are the chairman of the California Democratic Party's Progressive Caucus, and California has a vote coming up. California time. So loosely, let's just say in a few hours. We don't know exactly when the vote will be held, but there's a vote happening in the state assembly on CalCare, which would become, if passed, the first universal healthcare system on a state level in the country. So obviously we want to talk about that. I want to first, if you could kind of refresh people, because California a couple years ago had not CalCare, but its predecessor, a form of universal healthcare, passed through the state Senate, but it got killed in the state's House. Can you refresh people for when was that years ago and what happened with that in terms of that passing the Senate in California, but ultimately dying in the state assembly?
Yeah, so it's 3 years ago, and a lot has changed, and what we're proposing this time around is quite different from then. And it didn't get a vote in the assembly, and Assembly Speaker Rendon took a lot of heat because it was his decision not to put it up for a vote. But some of the criticisms that he had then, I think some were warranted, and they've been remedied now. But what happened at the time then is that we had a policy bill without a financing bill. And what we know is that folks at that time, if they wanted to do the work, they could have done the work, created the finance bill, but it didn't get done. And so they killed it. This time around, what Assemblymember Kalra has done is learn those lessons, and really for over a year has been thoughtful about the process. AB 1400 CalCare is what we're talking about voting on today, but it has a companion process, which is ACA 11. It'll actually be a constitutional amendment. A financing package requires federal waivers. That'll go on over the next year. And Assemblymember Kalra has, been to DC to make sure that we're going to have federal cooperation. So he went to Canada to see, consult with them on how they work their systems there. And most importantly, he's had the behind-the-scenes conversations here in the state capitol. So as opposed to last time, you've seen Speaker Rendon out in the media doing a lot of interviews about how good the process is, how good the bills are set up. You've seen the chair of the Health Committee, Jim Webb, who was opposed before, is now all the way in saying this needs to be passed, and really happy about the work. So it's just night and day from 3 years ago to where we are now.
And can you kind of talk about, we'll get to the vote and, obviously, political predictions are a dangerous business, but we'll get into that. But can you kind of talk about, because single payer kind of means different things to different people. And we know Obamacare was called kind of like universal health care, but not so much. Can you kind of just very specifically on CalCare, if it passed, my understanding if it would trigger a 9-person kind of government board that would run it in California. But what would people get as part of CalCare, and would it be free at the point of service?
Yeah, so this is really the traditional form of what we think about for single payer universal health care, free at the point of service. So we are going to take all of the different pots of money that are spent now on medical services in California and reimagine it, actually use less money to provide more services. So in addition to what we think of as primary care, you'll also have vision, you'll have dental, disability care, long-term care, elder care, everything you can think of really that aside from maybe cosmetic is going to be incorporated in this. And yes, there will be a board that will oversee this, but it'll be the same providers. What we're doing is taking out of the picture the insurance companies. And the insurance companies' main job is to deny care and make themselves money in the process. And what we're going to do is get rid of that and make sure that it is actually doctors, medical providers that decide what care you get and what care you should not get and what's the best for you. Those conversations should be had with the doctor in the room. And that's what this system is all about. And obviously there's more that goes into that, but that's sort of the short story.
Now, I'm not from California, but I do know there was an ungodly amount of money poured in from pharmaceutical industry, the insurance industry, to stop single payer years ago. I assume the vote that's happening in a few hours, they're not just sitting on the couch with their feet up, just waiting to see what happens. Can you kind of talk about the lobbying that has gone on to stop CalCare? I assume from the healthcare companies, big pharma, et cetera.
Yeah, I mean, this is a battle that's being waged, sure, right now over the last month, but really they have also learned some of the lessons when it passed through the Senate and they got caught a little bit. So what they did started from then is pouring money into elections, pouring money into the California Democratic Party. Look, even the California Democratic Party has 7 digits worth of healthcare money in its coffers that we have cycled through. And the same thing is happening with assembly members across the state. And we've seen over the last few days, $100,000 worth of Facebook ads. And we are talking about, the funding sources that you might expect. This is medical insurance, Blue Cross, medical corporations, and all the folks that profit off of the status quo, which ensures that people suffer for no good reason. And they want to ensure that that system continues, and they don't want to see every single person in California get healthcare. Because if they did, look, they've had decades. They could have figured out a system, based on their own profit motive, which provided healthcare. But they don't, because they don't want it to happen. And we're going to change that.
And remember, folks, smash the like button, share this live stream. So let me ask you, so I have it right. This vote that's happening today, this vote is basically if you should have the system, single payer system. So if it passes, there's a totally separate funding bill that has to be voted on separately. Can you kind of talk about what is, if this vote passes today, what happens? What is that corresponding bill? And you had also mentioned a constitutional amendment.
Yeah, it's a complicated process and it's a long one. We've had a few committee votes which we were successful in, and we haven't had any Democratic votes opposed yet. But today is really the first big step to take the temperature of the assembly members. So if it passes today in the assembly, then it'll go to the Senate and it'll go through committees, and you need a Senate vote, and then obviously the governor will need to sign. And that creates the policy that we want to do this, and here's the structures that are set up to do it. Then ACA 11 will take over from there, which talks about all the different ways to finance this bill. And even if that gets through the assembly and gets through the Senate closer to the end of the year, then there'll be a proposition that goes on the ballot statewide to have that taxing package approved by the voters. And what we'll be telling voters is, yeah, there's some taxes, but the vast majority of families will save every single month because they won't be paying premiums, they won't be paying copays, there'll be no limit on how much care they can get. And all of that just means savings.
And Tina, hopefully your internet's working these days.
Hi,
Amar,
how are you?
Amar has to be diplomatic, but where the bodies are buried, and California Democratic Party corruption.
Wait a minute! Whoa! Who said I have to be diplomatic?
All right,
so you don't know who got on the air here.
Then Tina,
the diplomat of the California Democratic Party.
Well, then Tina could ask because she's from California and knows better than me. But I'd like to know. The vote's happening today. It was 3 years ago. You're talking about things are different, and some people that were against it are now for it. But I would assume, there's still a lot of corporate-minded folks in the California Assembly that are listening to their donors who don't want it. Tina, if you want to chime in.
Yeah. Well, I think on one side, you have the California Nurses Association, which has obviously been supporting single payer in the state for many years, and they're doing it now. That's not going to change. On the other side, you have the Hospital Association, and you also have the California Medical Association. So big money on the opposite side for obvious reasons. And I think we're seeing a battle between these two divisions now. Now, there are doctors that are absolutely for single payer in the state. I'm thinking of, Ron Birnbaum, Doctors for Bernie, and some of the other folks that have been out there lobbying for this as well. But mainly the California Medical Association, which is physicians, has put their money against it. I think part of the problem, and Amar can speak to this more readily, is if it passes both chambers, it has to go to the voters for ratification. So it is, several hurdles here, and they're trying to make an issue in regards to the taxes that will be added. But as our
yeah, her internet's being funky. So yeah, what she was saying, if it passes today, does it still have to go to the voters?
Yeah, I mean that's the ultimate test for us, is that even getting through the assembly, it's got to go to the voters. And propositions in California over the last few years have been dicey because so much money is applied to just lie and fool voters. But what we have the advantage of here in California is that we have an army ready across the state, right? This is a state as big as it is and as expensive as it is to organize and advertise. It's still a state that went for burning. So we've done this before. We know how to win tough battles. And the California Democratic Party is not going to be an ally, even though they have in their platform that they support single payer, even though they endorse this bill. They take millions of dollars from folks that profit off of this. And the chair of the party, Rusty Hicks, I mean, he campaigned on single payer. He said, literally, I will fight for this bill. And he has been silent throughout this process. So this is something that we are going to have to win for ourselves, and we're ready for the fight. But we know that today, the assembly members are under a ton of pressure. So we have been organizing in every district. We have our own delegates, activists that are, contact the assembly members. We have our own tweet machine. CalCareTweets.com to send custom tweets to the assembly members. The California Nurse Association has been great on creating all the tools that activists need to make calls, text banks, all that. And we've had a really strong recent push from the California Labor Federation. They're soon to be led by former Assemblywoman Lorena Gonzalez, and they have also been out there saying the things that are obvious, that when labor has single payer healthcare and they don't have to worry about that at the negotiating table, they can fight for the other things that really matter. And that process of bringing labor into this fight is, I think, really changes the game, because they have so much influence in the assembly. You have the nurses union, you have the teachers association, who are also fighting for this. They are saying, yeah, go ahead and change our benefits, change the system that we rely on, because we know in the long term we can negotiate for a far better quality of life for our members.
Mm-hmm. And let's say it does pass today. How soon could it go to the voters? Because I read in the New York Times them saying that could wait. That might not be till 2024 that it would go to the voters.
Yeah, we'll see how that pans out. It's possible it could go this November. They can set it off cycle, but I think you're right that it'll probably be this November and the following November. So, and really, let's be fair, we need to take time to get that financing piece right. And if it takes a little bit of time and we take till November, that's no problem. And if there seem to be some things that need to be done with the federal government on the waiver process, that's fine, because we want to win this fight.
Right. And can you explain the waiver process? Because you look at, separate from healthcare, but in Build Back Better, Biden was selling universal pre-K. But in year one, it was predominantly funded by the government, federal government. But as the years went on, the federal government's portion of payment for the universal pre-K kept going down and down and down, to the point in year 6, the government wouldn't be funding the universal pre-K, leaving states to pay for it. So in CalCare, how much of the funding would come from federal government, and what are the waivers that you need from the federal government to allow it?
Yeah, so if you think back on Obamacare, there was this fight where some Republican governor said, look, we don't want the federal money. We're just not going to give medical care to our citizens, right? And it was sort of a weird position, but we're really thinking about the same process here, is that there is an established amount of money, whether it's Medicare or it goes to nonprofits from the federal government. And the waiver process really says there's a set amount of money. It's not something that's discretionary from the federal government, right? It's enshrined in law. And that what we're asking for is to take that existing pot of money, and instead of putting it through Medicare, you allow the state government to administer that money. And that's something that exists. And Assemblyman McCullough has already been to DC to speak with Javier Becerra, who's now in charge of Health and Human Services, and got his buy-in. We have our state senator, Alex Padilla, who's a strong advocate. He's already bought in. So I think we're not going to have really a problem on the federal side. But what Colorado has explained, and what's completely true, is that we need to have the policy bill created before we can then go to the federal government and say, look, here's what we have. Please assign that money now to our system. And then there'd be a similar process here in California, where we take our, the money that goes to county health, the money that goes to Medicaid, or our version, which is Medi-Cal, and divert that to a statewide single-payer system. So it's totally doable. And what folks, I think most folks don't realize, that the majority of the money spent in California is already federal government or state government or county government money. So we are not talking about a wholesale transformation of financing.
And Governor Newsom, too, you mentioned Rusty, but Governor Newsom, correct me if I'm wrong, ran on a single-payer healthcare system. What's he saying about this? Because, Biden ran on a lot of things, and then those policies mysteriously left his rhetoric. So is Governor Newsom supporting CalCare?
Look, Governor Newsom's been a mixed bag and has really been mostly hands-off on this fight. And I think this is something that happens, if we're fair, it happens with a lot of states around the country, and certainly happens in California, that once the legislature takes up a bill, you'll see the governor wait for it to get to his desk before chiming in. I mean, there are obviously exceptions. But certainly for Governor Newsom, you've seen some really tough language from the California nurses, because he had committed to them, and he had gotten their support largely on this issue. And they've been really tough on him for not being a leading advocate on this. But look, if this passes through the Assembly and it passes through the Senate, I just don't believe that he's going to do anything other than sign it.
So let me offer the cynical journalist in me. I know, you're California's Democratic the chairman of California's Democratic Party Progressive Caucus. So you're a Democrat. But Democrats nationally are pretty corrupt. Not that the Republicans aren't corrupt either. But I kind of have concern. All right, you get a victory today, but could there be funny business to try and either water it down or stop it at the voting booth? So people watching that might be cynical. Why should they trust that even if it passed today, if the state Democratic Party, the National Democratic Party, I mean, Biden has said, if Medicare for all came to my desk, meaning it passed both houses, I would not sign it. Granted, he's not the president of California, but the cynical part of me wonders, even if it passed through these mechanisms, even if you've learned from 3 years ago and fixed some things, what do you say to cynical people that say, the Democratic Party is not going to allow it regardless, even if it passes today?
No, I think you're right to be cynical. Let's face it, the California Democratic Party and Democrats in the Assembly have been a train wreck on a lot of issues, whether it comes to police accountability or climate change. Climate change is a really good one. I mean, we used to lead on that. Now we can't get basic bills passed, like getting just infrastructure away from schools. We can't get that. We can't get a ban on fracking. So there's a really good reason to be cynical.
Newsom's been handing out fracking permits like candy.
Yeah, there you go. And the California Democratic Party is a problem there too. I mean, they have still yet to find a way to say we're not going to take fossil fuel money while our planet and the state is literally on fire. And they haven't found a way to say we are not going to take police money, given all the things we know about how police oppresses communities. So look, there's a good reason to be cynical. But at the same time, California is what California is. And a state that was won by Bernie, and that our activists have been doing the work. So I'm not going to say that this is a slam dunk. There's a ton of work to be done. Right now, there are Assembly members that are thinking about voting down this bill, and we have our folks trying to pressure them. So it's not a slam dunk at all. It's a good reason to be cynical. If Gavin Newsom has aspirations out of California, he's looking at this as that, is this the bill that's going to kill me in California, and I'm not going to have an ability to get the support of the state? Or is he looking at this as a time that I'm going to make a deal with, folks with money for my future prospects? And it's up to us, and we've been doing a pretty good job of it, to make clear that, look, if you're a politician in this state, you can't get out of this state without being on our side. And take a look a few months back when, we had an open Senate seat. It was a real question who and what type of senator we were going to get. It's going to be another sort of play ball moderate, whether you get a true progressive. And it was our organization and Roots Action and so many others, our revolution around the state, that leaned into that fight. And it was, the California Labor Federation and so many others that said, look, the senator has to be right on the filibuster. They have to be right on Medicare for all. They have to be right on, a bunch of other issues. And as soon as we did that, we had folks like Alex Padilla starting speaking vocally. Yeah, I'm on board. I'm on board. I'm on board. Because I think the lesson has been learned here now that you can't be wrong on these issues and think that you're going to have a political future. And that's what we're leveraging.
Well, what's interesting to me, if Gavin Newsom has political ambitions, obviously beyond California governor, that would be the White House. Well, I mean, contrary to the current president, who, seems to be living in 1985 politically, I mean, in every single Democratic primary in 2020, every state, even the ones Bernie lost, Medicare for all, single payer, had majority support, including in Mississippi and southern states. So, a lot of the pundits like to say, don't trust the polls. If you actually ask the question a certain way, people don't support it. But I don't know. I've seen polls with almost majority support among Republicans for Medicare for all, a single payer system. I assume it's popular in California, which not just on COVID, but, is one of the biggest states in the country and has a lot of healthcare costs. So you would think politically, if he had ambitions beyond California, he would recognize that this is very popular.
Yeah, I think you're right. Look, if labor is endorse and support this bill and this process, right? We have teachers, nurses, all the different labor federations joined together. Like you're saying, the people are behind this bill. The party supported this bill. The only folks left on the other side are the folks making money from people dying and denying them healthcare. And that's the message that we're carrying forward. So, there are some political realities that you have to get fundraising, and you need money from folks in order to, be successful in your next campaign. But, we've also proven that, small dollar fundraising works in California. And, right now we're testing that across the state. And there's going to be some endorsement battles over the next couple of weeks that are going to be dependent on what happens today.
Mm-hmm. And can you kind of talk about in the separate accompanying bill, which is the constitutional amendment, it proposes, tax hike on business, large companies, and wealthiest Californians to fund the single payer. Well, we know some of the biggest national donors come from California, and we know they don't want their taxes raised and this and that. So can you kind of talk about, I mean, obviously there's a pretty entrenched conflict of interest, not just in California, but in general. The wealthy donors who you and others are proposing to help pay for this, they don't want their taxes raised.
Mm-hmm. Yeah, we haven't heard wealthy donors weigh in on this bill much. It has been almost exclusively the medical corporations that are in on this. And I think a lot of that is because the details of that financing bill and how the taxes weigh out are yet to come. So, what the message we're giving assembly members is, look, if you support single payer healthcare, you want to be the guy or the gal that voted for everybody to get healthcare, then vote for this bill. And we will work on what comes next on that financing. But, even then, when we talk about the financing for small businesses, it'll be less expensive. For a lot of corporations, it's going to be less expensive. We are, not even talking about the massive tax on entrepreneurship that the current system has, is that folks are tied to jobs that they don't want, and they stay there because of their benefits. So there's a positive effect on business development when folks can go out and start their own businesses when they're not tied to these jobs. But we feel really confident that even when we get to the financing part, when we start drilling down on that message and we show these spreadsheets of your average business, your average family, how much they are going to save, I think we're going to get a lot of support.
Gotcha. And can you kind of talk about also in terms of if this were to pass and getting it to voters, if it passed and went into effect, that's kind of step one. I would compare it to like unions trying to get unionized and win a union vote, but then the next step is collectively bargaining. How long would it take? What are the kind of the nitty gritty to actually implement the first ever universal system, in the country? What would that look like in terms of if it actually passed, if the voters then validated it? How long would it take to get this off the ground in California?
Yeah, there's a lot of still work to be done to flesh out how the financing works, and meaning like you end one program and now you've started the next. What's the transition period going to be? But I think 1 to 2 years is safe.
1 to 2 years, okay.
Yeah.
And could you kind of also talk about, to me, the kind of smear has on the national level has always been how you're going to pay for this. I don't know. I mean, California, you already said, spends a whole lot of money already on healthcare. It spends a whole lot of money on other things. Frankly, there's a lot of handouts that's been given to fossil fuel companies, the fracking industry, this and that. So can you kind of talk about in terms of fleshing out a little bit more how this would save California money? Because the Democrat establishment always likes to act fiscally conservative, but then completely ignore the fact that this is the most wasteful healthcare system in the world.
Yeah, I mean that's the bottom line. If you look at any study on these types of systems around the world, right, they routinely show, and there's broad consensus that ours is the most expensive with some of the worst outcomes from the industrialized nations, right? So, and if you just think about that one idea, that we get the worst outcomes, all right, you think, okay, they're the bad outcomes, but that's actually a lot of dollars and cents. We are killing our own people. We are hurting our own economy. We are putting people on disability. We are taking them out of the workforce just because we don't give them adequate preventative care. And there's a really good example over the pandemic. If you look at the people that were hurt the most, that are disabled off the job the most, it's often urban communities, people of color. And say, okay, well, that's because they have, pre-existing conditions, or, their mortality rates, whatever their reason, they're higher in these communities. Well, why is that? It's because they don't have proper, adequate preventative care so they stay healthy, right? They don't have the kind of conversations with their doctors. And nowadays you go, and especially in these communities that are poorer, you're lucky if you get 5 minutes with your doctor. You probably get less, right? These people need to have, relationship building conversations with their doctors like we had a generation ago. So which promote long-term health. And that alone is a massive savings to our economy. But then if you think about the other things, right, is that we'll take out the profit that goes to insurance companies on administration. Again, the studies that have looked at this, even Republican conservative think tank studies on this, say that the single payer system will actually save money. And then we add to that the fact that we are going to provide more service within the same amount of money. And we will negotiate on drug prices, right? It's just ridiculous right now that we pay way more than we have to under the Medicare system for prescription drugs. And then, this is a bargaining power on not just drugs, but on everything that California does. Fifth largest economy in the world. We have the ability to set prices, not only for ourselves, but then set an example for other states. When other states see the kind of success and, bargaining that we're going to be capable of, I think we're going to turn a lot of heads. And, finally, I think I'll return to that one other point, is that we simply cannot measure the increase to the quality of life and freedom to pursue other opportunities when folks have healthcare. I mean, you just think about all the decisions we made, when it comes to raising our kids or having kids. Let me manage it just right so I can be off at just the right time and be at just the right job, just for family planning. Let me make sure that my dad works another couple of years so he can get the right benefits so that he can take care of that prostate cancer that we know is going to develop because he's already got some bad test results. I mean, those kind of things just aren't measurable, and yet we know there may be the largest impact of a single payer system.
Well, might I also add, it might influence how you act in a global pandemic where California has been hit massively hard, like New York. I don't have the data, but I do know, there's some people that don't, even if they should be hospitalized, will not go to the hospital for fear of that bill.
Yeah, we had folks turning down vaccines because they thought, even though, despite all of the attempts by the government to get the message out there that everything is free, there were still folks that thought that, oh yeah, the vaccine is free, but if I go to get it, the doctor's going to charge me something, so I'm not going to get that.
Right. It's crazy. Hey, can you kind of talk about just the political muscle part? Because I did see, and I know you got to go soon, so
yeah,
I'll wrap it up. But the political muscle, because Biden and the Democrats nationally, and frankly, in my view, a lot of elected progressives go to knife fights holding spoons, political fights, not actual fights. But you guys are using some muscle. You're threatening to withhold endorsements for candidates that vote against CalCare. Can you kind of talk about what kind of leverage you're trying to use to whip those assembly members who, might be close to voting no on this?
Yeah, it's really interesting how this has played out. So, when this bill, AB 1400, first came up, we couldn't get a committee hearing, and Ash Calder still had some work to do. So the Assembly thought it was smart by saying, okay, we're going to put this into next year. But what they did is now put it onto the calendar in January, immediately before our endorsements in February. So literally, the vote will happen today, and then 5 days later, we start voting on endorsements. And folks' memories are short, but they're not that short. I mean, the folks that are going to vote in a few days are going to look at, who voted and how. And the Progressive Caucus, I'm the chair there, we saw this coming, as soon as they made that decision to shunt it out for another year. So we've been preparing our activists for a few months now with emails and seminars and our meetings, doing some work that really hasn't been done in the party before, where we are explaining exactly how you take a assembly member off of automatic endorsement, and that you ensure that we get a vote, and then giving them the courage to vote against endorsement and to look either just to not endorse anybody or to endorse a progressive challenger, but just the idea that we're going to have a vote, which really caused some some squealing from the corporate Democrats. Because look, when we put out this message, we didn't do a media campaign on it. We know this is an internal Democratic Party exercise, and we need to challenge our activists and challenge our delegates to do this work inside the party. But it was actually the corporate Democrats in their own caucus meeting. This is part of reporting that they were sending screenshots to the press saying, "Oh my God, the progressives are coming after us." And I guess they didn't realize that, the people are on our side, and they want to hear folks stand up for principle. They want to hear progressives stand up for what's right and stand up for single-payer healthcare. So when that story got out of their caucus to the media, all of a sudden the assembly members shut up, and they didn't want to go on the record. And it's really our narrative that has carried the day. And they have a good reason to be afraid. Look, folks want the votes to be yes, and the only ones that don't are the ones making profit on us. And so we're leaning into that, and now we're seeing, we're having discussions with statewide labor on leaning into these endorsement battles. And why they're important is this: that if you're endorsed by the California Democratic Party, sure, you get the branding of the party, but what you also get is activists, door knockers, flyers, and a ton of money that goes from the party directly into your campaign account or from the party directly into mailers to help you get elected. And if you don't get that money from the party, you got to go raise it yourself. And if you're not the type of person that has built a relationship based on values, you got to go get that from corporations. Well, then whoever you're running against, that gives them a huge weapon, because you got to
Mhm.
spend your time explaining why you're taking corporate money, why you're not getting the endorsement, and it puts a lot of folks who maybe thought they had an easy path, puts them on a path that's much more difficult. And we have laid down the gauntlet that we are going to do this. We don't care about what the repercussions are within the party. That this is too important. It's going to get done. What we're hoping, though, is that it doesn't have to happen. That they pass it today. They know that we're ready for that fight, and they want to avoid it.
And lastly, and this is kind of it's a tough question I have to ask every Democratic Party person I interview, but there's a lot of viewers who feel this way, not only my show, but I'm sure you're seeing it elsewhere. They're calling people like you naive. They're calling people like Jordan, why bother even covering this bullshit? If it's a Democratic Party, that's where progress goes to die. I'm sure you've heard it, you've seen it elsewhere. So to those people, that it's more than cynicism. It's no, if it's the Democratic Party, I'm talking about people that even supported Bernie, but have just completely falling out of favor. What is your message to them who say, no, I'm for single payer, I'm for Medicare for all, but not doing it within the Democratic Party. I'm going to do it through third party. I'm going to try and build a third party, or I'm going to try direct action because this is a fool's errand. What would be your rebuttal to people, not bad people, they just have grown very cynical?
Yeah, I don't think you should trust the Democratic Party because it's a Democratic Party. But here's what we know. In California, there's two parties that control the game here, and the Republican Party is a bigot train wreck. So you've got to be in the California Democratic Party in order to get the work done, like we're doing today. But that's not where all our energy should be. I completely encourage folks to be outside the party, organizing in their communities. And we actually had a full meeting on this in our caucus a couple of months ago about adjusting our organizing, that we should not be in the party working on platforms and resolutions and rules and that. We should get in the party for votes and to leverage our power aggressively like we're doing on this CalCare fight, but not for all the other stuff, right? That other time is wasted when you should be in your community trying to elect progressives. So, we've seen recently the Working Families Party is making a move in California. And Assemblymember Ash Calver, who's the author of the CalCare, he was out there at their kickoff meeting for Jane Kim as the new leader in California. I attended that too, and folks were giving me a call out, and they talked about the work that we're doing in this during the presentation, and I think that's the right way to do it. You are going to keep the Democratic Party honest when you have alternatives. Now, the Working Families Party, thankfully, is not on the ballot this time around. So we can work really closely because they're not, officially competing with the Democratic Party. But, look, I think folks should organize in whatever way they see fit. And if you want to work in your community to create another third party in the city, or or organize around an issue, do it. I think that's effective. We cannot have everybody in the Democratic Party. It just doesn't work. And even the folks like me that are working inside, we have our feet outside too. That's just the way it has to be done.
Gotcha. And real quick, California's got a pretty bad homeless problem. I mean, the whole country does, but California, San Francisco, Los Angeles, a whole lot of other cities. Every person is different, but I would assume if that extra cost is off the table, if every Californian is getting help through the government, that might alleviate some of the economic burden on people who end up. Sometimes it's just missing, not being able to cover that one thing. You get evicted, you're on the streets. Can you kind of talk about the connection between if California could get this single payer done, not only, lifting people out of poverty, maybe helping to alleviate a little bit homelessness. That's not going to address the out of control rent prices, which are really driving a lot of the homelessness. But can you kind of connect the dots here? How healthcare could help those other issues?
Yeah, I think it's interesting how the challenges of the unsheltered, how we talk about them in California or in the Democratic Party, is that we often think about they're on the street, so that's not a cost to us, so don't worry about it, and we're just providing the meager basics of some wraparound care and obviously a ton of law enforcement. But what CalCare is going to do, and there's not a lot of discussion about this, but it's an interesting point you bring up, is that by giving everyone health care, yes, it improves their quality of life and improves their ability to, get the help they need and to get a job or to be with their families or whatever they're looking to do. But what it also does is by putting that cost on the state, it incentivizes us to see them as, a cost, and that we shouldn't just pour medical money at them, that we can actually save on medicine, save on medical services if we provided housing. We could actually save on medical services if we provided job training. We could save on medical services if we provided, a monthly basic income. So I think, one of the benefits is that as we increase the medical care, there'll be an incentive to save money on medical care by providing completely holistic wraparound care that actually improves their way of life. And maybe some of that money will go into housing, which is obviously the number one problem. If people on the street, give them shelter. I mean, that's what they really need.
Absolutely. Thank you for taking the time. I know the vote is starting pretty soon. If it passes, maybe we'll have you back for the next steps. But thank you for the work you're doing on this. Amar Shergill, you're the head of the California Democratic Party's Progressive Caucus. We'll monitor whether this thing passes today. Thank you for everything you're doing.
Yeah, thank you for having me. I missed not having Tina here. Missed that energy, but next time.
That's the next cause you should focus on in California. getting Tina reliable internet. That's been fun. Spectrum monopoly is not good. Thank you very much.
Take care.
So that was Amar Shergill, the head of the California Democratic Party's Progressive Caucus. And I really liked. And by the way, we're going to get to another very important topic in a few minutes, so don't go anywhere. Yes, I do need to chime in on Joe Rogan. All the rage, Joe Rogan and Spotify and the controversy. So I want to give my thoughts. But I like his answer. I liked his answer specifically to the cynical people. I liked his answer specifically to those that have reached the point where they're done with the Democratic Party. And, contrary to, a lot of things people say about me, I'm not sitting here. I don't tell people vote for the Democratic Party. I sit here saying I think Nina Turner would be better than the corporate crony that is currently in Congress representing Cleveland and Akron. But I don't, tell people, oh, vote blue no matter who, this and that. I chose, which I still get grief for my own reasons, to vote for Biden. But I didn't tell people to do it. I didn't say you're evil if you don't vote for Biden. I told my audience, do whatever the hell you want. And I say now, vote for the Democratic Party. Don't vote for the Democratic Party. Dem enter, dem exit. It's up to you. But I really liked his answer specifically on when I asked him, what do you say to cynical people? And he basically says, you should be cynical. You should not trust the Democratic Party. And he basically invites alternative strategies, this and that. I think that's a good answer. And it doesn't negate what he's trying to do and what activists in California are trying to do to get CalCare through. But it also doesn't dismiss people that have reached a different point that they're not going to support the Democratic Party or try to get universal health care through the Democratic Party. So I thought that was a good thing. Super chat. Jesus Alvarez, or Jesus, if I'm mispronouncing it, $10. Thank you for covering this. I live in the Bay Area and I hate seeing homeless people sleeping on the side of the freeway in tents in an extremely wealthy city like California. Jesus, I got to tell you, my wife and I last year went on a belated honeymoon. We actually got married in October of 2020, but because of COVID, it was horrible COVID, early at that time in 2020. So we really couldn't go on a honeymoon. So we went in 2021. We went to a few places, but we finished in San Francisco and Napa Valley. And boy, I was a little bougie in Napa Valley. I did get a little inebriated for 2 straight days, and it was wonderful. But when I was in San Francisco, literally, I had been to San Francisco maybe 4 years earlier. So from the 4 years earlier than I was in San Francisco reporting to when I was there for my honeymoon, the homeless problem, it has gotten so much worse in just 4 or 5 years. since I had last been in San Francisco. The area that we stayed, I forget the name of it, where our hotel was, but I mean, it was just surrounded by homelessness. And, you know, it's just heart wrenching, not just in San Francisco, but I've seen it. I've reported in Portland and seen bad homelessness. I've seen it in Los Angeles. I've seen it pretty much every city I go to, some worse than others. But in California, there are tent cities all over the place. And it's run by Democrats. You know, I'm not trying to push Republican talking points, but California is run by Democrats. And gentrification has run amok in Seattle, in San Francisco. Silicon Valley is in large part the driving force in places like Seattle and San Francisco. Amazon is a driving force in Seattle. So yeah, homelessness is horrible. Not that single payer in California would alleviate homelessness, but it would alleviate some economic burden. So you got to be happy for that. Thank you. New YouTube member, AIS, new member. And by the way, before I get to the next topic, I want to give some shout outs because over the last 2 weeks, 2 weeks ago today, we broke our latest, I broke my latest story regarding the Flint water cover up. I was fortunate. We got on a bunch of different shows. Brianna Joy Gray had me on. The Vanguard had me on. Breaking Points covered it. They didn't have me on, but they covered it. I was able to go on with Ring of Fire. I went on with Tim Black. I went on with Savi Sabs. I hope I'm pronouncing it right this time. Went on a bunch of shows. I'm probably forgetting a couple shows. Oh, The Rising I went on. I was able to go on a bunch of shows, which gave Status Coup more exposure because more people who had never seen Status Coup before finally saw and learned about our channel. We've grown over 4,000 new YouTube subscribers, which is awesome in just 2 weeks. But we've also grown over 100 paid Status Coup members / patrons. And we just had our members call last week with our paying members, which we do once a month. So I want to give a shout out because we're still getting new member signups. And I hope this momentum continues because this is how we're going to grow. If we could keep getting new member signups, meaning every day, people signing up for paid memberships, it will very, very much help us hire more people and fund more on the ground reporting. So shout out, we got 1, 2, 3, 4, 5, 6, 7 new members just today. Andrew, Richard, Kathleen, Donna, Adrian, Bruce, Julian, Paul, and Megan, and Michael. So 1, 2, 3, 4, 5, 6, 7, 8. Oh, that's 8. Excuse me. 1, 2, 3, 4, 5, 6, 7, 8. So 8 new members just today. We had a bunch of them over the weekend. So thank you to Tamara, Jennifer, and a couple others over the weekend. I don't want to waste so much time, but thank you to all those signing up. It's pretty simple. For $5 a month, you could fund investigative reporting that very few others are doing, as well as on-the-ground reporting. I am hoping to be able to get back on the ground in the next few weeks as cases go down. So please sign up, statuscoup.com/join, $5 a month, 16 cents a day. 16 cents a day equals $5 a month. We do have higher plans too, so I've been really encouraged that we're seeing people sign up even at $10 a month. We've had people sign up at $20 a month. We've had a lot of people signing up at our annual level, which is $179 annual. And just as a reminder, you get access to our monthly Zoom call with members, so you could join us for next time if you missed the last one. You get behind the scenes videos. We have a members Discord channel just for members. So there's a lot of great perks. And most importantly, you get to fund actual reporting. I don't really see many others covering the CalCare vote today. I certainly don't see any other channels really covering the ongoing Flint water cover up and all the other stories we cover. So thank you. Unfortunately, Tina's having internet problems, which off air, we're going to try and figure that out because obviously we want Tina on. So let me address this whole hubbubaloo about Joe Rogan and Spotify, because honestly, boy, it's really, if you get, it's one of those lose-lose. Like if you dare criticize Joe Rogan, you could lose a lot of subscribers. And if you don't criticize him enough, you could lose a lot of subscribers. I'm not going to do things based on gaining or losing subscribers. I'm just going to tell you what I honestly believe and go from there. So Recently, I guess over the last couple days, there was a huge campaign to remove Joe Rogan from Spotify because of a lot of the COVID coverage, a lot of the things he has said about COVID, a lot of the guests he has had on about COVID, and Spotify actually, as part of this campaign to get him removed from Spotify lost $2 billion. $2 billion in just a few days in terms of its market cap or whatever those fancy terms are. But this has hit Spotify where it hurts because Joe Rogan is exclusive on Spotify. And Spotify has been there was just floods of cancellations online over Joe Rogan. So I kind of have a nuanced view on it. Some people might not agree. That's fine. I don't think Joe Rogan should be removed from Spotify. I think that's going too far. I think that Joe Rogan has, intentionally or not, even if it's unintentionally, I think he has put out stuff that's factually not true about COVID. And I think he views himself as, I'm just kind of an everyman. I'm not an expert. I just have conversations. And that's great. I barely have time to watch like 5 to 6 minute videos. I have never watched a full Joe Rogan, 3-hour show. I don't even have Spotify. I've seen clips of him on YouTube and I like some of his stuff. However, some of his stuff in his mind, I'm just having casual conversations. I don't think he realizes sometimes that he's having those casual conversations to 11 million people. I think that's the size of his listenership, way more than cable news. So I'm all for, my issue with Joe Rogan is not necessarily that he has had Dr. Robert Malone on, or people who, in my view, based on data and science, are spewing bullshit. My issue is not necessarily that he's had those people on. My issue is when you have people like that on, you have to push back when they are spewing stuff that is very much against data. And everybody has a different mentality because some people say, oh, well, they're the truth. Dr. Robert Malone is the truth teller. And these other doctors that Rogan has had on, they're the truth tellers. And all these other people, they're just big pharma shills, this and that. Well, at the end of the day, Joe Rogan and others would have to believe there is a massive, massive cabal going on where all the doctors, all the nurses doing these videos from hospitals about how overloaded they are and how the majority of patients are unvaccinated and all this, you would have to believe there's just this giant cabal going on to lie to you. And there's not. So my issue isn't necessarily that he has these controversial guests on. My issue is when those controversial guests push irresponsible things, you're not just doing a podcast in your basement now where mom and dad are listening. You have 11 million listeners. And with that, you have a responsibility. And if you're not an expert on things, then you have to do enough research to be able to push back when people are lying. So my issue isn't necessarily that he has those people on. It's a lot of times he has people on, not just for COVID. We're also talking like alt-right figures, some hardcore right-wing figures, and he doesn't push back. And you don't have to push back in a way that's, hammering over the head. But, there are ways to push back where you're still being respectful. But my broader issue is not really the guests he has had on. My broader issue is stuff like this. Colin, if you have the clip where early on in the pandemic, he just put out, again, he's not an expert. He has no epidemiological expertise, none of that. He just kind of casually, because I guess this was his opinion, put this out to his 11 million listeners.
People say, do you think it's safe to get vaccinated? I've said, yeah, I think for the most part it's safe to get vaccinated. I do. But if you're 21 years old and you say to me, should I get vaccinated? I go, no. Yeah. Are you healthy? Are you a healthy person? Look, don't do anything stupid, but you should take care of yourself. You should, if you're a healthy person and you're exercising all the time and you're young and you're eating well, I don't think you need to worry about this.
Yeah, I tend to agree with you.
But there's a lot of jobs that will tell you you need to have this.
Well, that's what's starting to happen
They're
now.
people are worried about them doing it for their children. And
So there's a key word in there. There's a key word in there. And this is what I mean in terms of there's a conflict between, you know, when somebody like Joe Rogan, and we'll play some of his Instagram video that he did, which, you know, he was in some ways kind of pulling things back. Then I thought he was diplomatic in certain ways and a little bit more open to being a little bit more responsible. I actually thought the Instagram video he did was pretty good. But when he says, I think, again, you have the biggest audience that I'm aware of, one of the biggest audiences in America. So this is not some like political opinion. A lot of people think like, oh, this is just like anything else. You know, we should debate and have opinions. There's certain things that I think, sure, debate it. I think it's fair to debate. Should we have vaccine mandates or should we not? I think that's a fair debate. And I understand both sides have different opinions on that. I think that's a legitimate debate to have. But when Joe Rogan, again, with zero medical expertise, none, with zero epidemiological, and I'm mispronouncing that, but he's not an epidemiologist. He's not a medical person. He's not a scientist. When he's just casually with a co-host early on in the pandemic telling 20-something-year-olds, if you're young and healthy, I don't think you should worry about this. That is irresponsible. Let me repeat. It's irresponsible. I get he's an everyman and he's not an expert, and that's part of his charm, and it's free-flowing conversation. But you have to realize when you're saying these things, is ultimately it's up to his audience what they're going to do. But you do influence the way your audience thinks. You do influence what they ultimately do because they're coming to you because they trust you. And what he said at that point, of course, there's no way to quantify how many young people didn't get vaccinated because they heard that from Joe Rogan. But what he said is not true. This whole notion that, if you're generally young and healthy and you work out and this and that, you're not really vulnerable to this. Are you as vulnerable as a 75-year-old with comorbidities? No, you're not. However, Colin, I mean, we could just show it. This is NBC News from July 2021. Young unvaccinated people are being hospitalized with COVID as Delta variant spreads. Quote, we are seeing patients in their 20s and 30s who are otherwise healthy who are coming because of worsening symptoms. One Kansas doctor said. Again, otherwise healthy who are coming because of worsening symptoms. Young unvaccinated people are showing up at hospitals with COVID-19, in some cases being admitted to intensive care and put on ventilators in disturbing numbers, health officials across the country have warned. Vaccination rates among younger people are lower than among older Americans, according to the CDC. The agency's data shows that slightly fewer than half of people in the U.S. age 18 to 24 and 25 to 39 are fully vaccinated. The number is even lower for children 12 to 13. So that was from July of last year. Now, Colin, if you have the LA Times article, and this is from August of 2021, headline, hospitals see more unvaccinated, younger, healthier people with COVID-19. So again, I don't think Joe Rogan is intentionally trying to kill people, but sometimes when you're just casually saying things because, hey, my mindset in general is, well, just be healthy, just eat right, just work out, these kind of things. If you do those things, you'll be fine. You don't have the medical expertise. You don't have the epidemiological expertise. You don't have the scientific expertise to make those statements. That doesn't mean Joe Rogan is completely awful. I've seen some clips, not COVID related, other interviews he's done where I really enjoy the content. It doesn't have to be all or nothing, but you have to realize that when you're saying these things and you're caveating it with, I think, well, yeah, you could say, well, I'm not telling people what to do. I'm just saying what I think, but it has the effect that you're telling people, yeah, don't get vaccinated. If you're a young person, don't get vaccinated. Well, the numbers show young people that are unvaccinated have been hospitalized, and there are young people who have died. Is it in the same stratosphere as older people? No, but there's still a lot of younger people 20s, 30s, 40s that have died from this. Colin, if we can go back to that. Hospitals see more unvaccinated, younger, healthier people with COVID-19. Hospitals are seeing a greater number of unvaccinated people who are younger and otherwise healthier fill up their beds, according to new data released by Los Angeles County. Among adults and the oldest teenagers who are hospitalized with COVID-19, the median age of unvaccinated or partially vaccinated patients was 51. That's notably younger than the median age of fully vaccinated patients in the hospital with COVID-19. Fully vaccinated people were also less likely to need admission into the intensive care unit or to have such difficulty breathing that they don't need to be sedated and have a breathing tube inserted into their mouth. Quote, these findings suggest that vaccinations contributes to a less severe course of hospitalization among people who ended up infected with COVID. So then we move on to most recently. This is from just a week or two ago in the Washington Post. Nearly all teens needing intensive care for COVID-19 were unvaccinated. Study shows. Nearly all teenagers needing intensive care for COVID-19 were unvaccinated in a study of more than 1,000 hospital patients in the U.S. The Pfizer BioNTech coronavirus vaccine prevented 94% of hospitalizations and was 98% effective at keeping patients out of the ICU or from requiring life support, per the peer-reviewed analysis published Wednesday in the New England Journal of Medicine. As pediatric hospitalizations surge in many parts of the U.S., fueled by the more transmissible Omicron variant, the study's findings help illustrate how vaccination can protect young people from severe complications and death. Quote, nearly all hospitalizations and deaths in this population could have been prevented by vaccination, writes Catherine M. Edwards, scientific director of the Vanderbilt Vaccine Research Program. So I'm sure Joe Rogan, again, I don't think Joe Rogan is intentionally saying things to hurt anyone, to harm his viewers. But you got to understand, I don't care if you are a UFC fighter or whatever he was, UFC commentator turned podcaster or a game show host turned podcaster. I think he was in, what did he host? Fear Factor or something like that. You have to realize that when you are having, because the clip I showed you where he just casually was like to a 21-year-old, should you get vaccinated? No, that's what he said. So it's not always that he's having conversations with controversial doctors. He has said things when he's not interviewing doctors, when he's not interviewing, contrarian or medical people that have a different opinion. He has said things very casually that an overwhelming amount of data contradicts. And the times that he has said those things, he doesn't always have a guest on that challenges him. He doesn't always have a guest on that corrects him. A couple of weeks ago, there was a guest, an Australian guy, I forget his name, that corrected him on something. And he kind of hemmed and hawed at that correction, even when he was being corrected. But he doesn't always have a guest on that's going to actually correct him. So, to me, there's multiple reasons I don't think he should be removed by Spotify. Number one, I think if the goal of people is to remove him from Spotify to make him less harmful or something like that, it's only going to make him bigger, because it would only strengthen a lot of people who already don't trust the government and who are already very mistrusting of vaccines and masks and want this over, to think, see, they are trying to control us. They are trying to hide us. They're getting rid of the truth. They're getting rid of Rogan. So if the goal is to stop misinformation, it would only amplify and elevate misinformation if you removed him off of Spotify. Secondly, I think he's being irresponsible in many of the conversations he has, in many of the things he says. But I don't believe he should be removed unless he is actually stoking violence or calling for violence and this and that. There's a whole lot of irresponsible people on YouTube, on other platforms. We can't just remove everybody. I think there has to be significant violations that are against the law to start removing people from these platforms. But with that said, although I don't believe he should be removed, I also have zero issue zero issue with people canceling their Spotify memberships and answering with their wallet and speaking with their wallet. For the free speech absolutists out there who say Joe Rogan should be able to say whatever he wants, speak to whoever he wants with no censorship, I don't have an issue. I don't think he should be removed. If people's purpose in canceling their Spotify memberships is to remove him, I disagree with removing him. However, they have every right to cancel their Spotify memberships. There might be freedom of speech. There is not freedom of consequence. So if you are going to, either because you're too casual or you're not well researched enough, or, you don't have the background, if you're going to say things that are significantly contradicted by data and science and what's happening on the ground in hospitals, if you're going to say things like, yeah, young people don't bother getting vaccinated, if you're going to have people on like Dr. Robert Malone, who are irresponsible, who cherry pick data to suit their narrative, who make interesting claims that they are the inventor of the mRNA vaccine, but if you look into it, they are not the inventor of the mRNA vaccine. If you're going to do all these things, well, you don't have a right to make gobbles and gobbles of money off of it. So I don't think he should be removed from the platform, but I have absolutely no problem with whoever wants to cancel their memberships to Spotify. He still has a right to say it, but he doesn't have a right to your money. If you don't agree with what he's saying, if you think he's irresponsible, if you think he's putting out dangerous misinformation, then your speech you could speak with your wallet. And I think that's completely fair. So to the free speech absolutist yelling at people who are canceling their Spotify, I don't agree with that. If he has freedom of speech to say what he wants and to speak to who he wants, then people have a right not to support Spotify financially. And I think that's absolutely fair. I wanted to address Rogan's, he did a 10-minute Instagram video. I'm not going to say the whole thing, but I wanted to address some of it, because some of it I thought was good, and some of it I think kind of strengthens the point I'm trying to make. Colin, if you could play the parts that I had sent to you.
All of those theories that at one point in time were banned were openly discussed by those two men that I had on my podcast that have been accused of dangerous misinformation. I do not know if they're right. I don't know, because I'm not a doctor. I'm not a scientist. I'm just a person who sits down and talks to people and has conversations with them. Do I get things wrong?
Can you pause it for a second?
Things wrong, but
So that's part of the problem. That's part of the problem right there. So he's saying, do I know if the people I'm having on are right? No, I don't. I don't know if they're right. He says, I'm not a doctor. I'm not a medical professional, this and that. Well, if you're not a doctor and you're not a medical professional, why are you very, very deliberately telling your viewers, hey, if a 21-year-old asks me if I should get vaccinated, a young, healthy person? No. You can't have it both ways. You can't shrink behind, I don't know if Dr. Malone or other people, what they're saying is true. I'm not a doctor. I'm not a medical person. But then you're very definitively and with confidence telling young people don't get vaccinated. You cannot have it both ways. Now, you could say, I'm not a medical expert. I'm not a scientist. I'm not an epidemiologist. I try my best to do as much research as possible when I have these guests on. But there are some things that I'm going to miss because I'm not an expert, but I'm going to have them on. I'm going to have the Dr. Malones on and things like that. But I'm going to do a better job of having other experts on that do have the expertise to rebut things that Dr. Malone and these, contrarian medical experts. That is more reasonable. But he can't say, I'm not a doctor, I'm not a medical person, but we played you the clip earlier. He very confidently and with no equivocation was telling young people, and by the way, a huge chunk of his audience is younger men. Yeah, you shouldn't get vaccinated. If you eat kale and you work out, you're fine. Well, we've already shown you that's not necessarily true. Colin, if you could play that from the top again.
All of those theories that at one point in time were banned were openly discussed by those two men that I had on my podcast that have been accused of dangerous misinformation. I do not know if they're right. I don't know, because I'm not a doctor, I'm not a scientist. I'm just a person who sits down and talks to people and has conversations with them. Do I get things wrong? Absolutely, I get things wrong, but I try to correct them. Whenever I get something wrong, I try to correct it because I'm interested in telling the truth. I'm interested in finding out what the truth is. And I'm interested in having interesting conversations with people that have differing opinions. I'm not interested in only talking to people that have one perspective. One of the things that Spotify wants to do that I agree with is that at the beginning of these controversial podcasts, like specifically ones about COVID, is to put a disclaimer and say that you should speak with your physician and that these people and the opinions that they express are contrary to the opinions of the consensus of experts, which I think is very important. Sure, have that on there. I'm very happy with that. Also, I think if there's anything that I've done that I could do better is have more experts with differing opinions right after I have the controversial ones. I would most certainly be open to doing that. And I would like to talk to some people that have differing opinions on those podcasts in the future. We'll see. I do all the scheduling myself, and I don't always get it right. These podcasts are very strange because they're just conversations. And oftentimes I have no idea what I'm going to talk about until I sit down and talk to people. And that's why some of my ideas are not that prepared or fleshed out, because I'm literally having them in real time. But okay. I do my best. And
so that's the second part that I take issue with. Okay. You got 11 million listeners, man. I mean, so again, when you have, nobody is asking Joe Rogan to go to medical school so he knows everything about epidemiology or data and he understands how to read a study. But, when you have one of the biggest audiences in the country, I'm not saying don't have differing opinions on, don't have controversial people on, but you can't just say, I'm just having conversations and, they're just very casual and my thoughts aren't always fleshed out and I don't know what I'm going to talk about. I mean, maybe then you have to slow down your schedule of how many guests you have on to give yourself a little more time to research. I don't know the answer. I don't know his programming schedule. I don't know how much output he's doing, but freedom of speech is fine. I don't think he should be removed. I'm against that. But that doesn't mean you don't need to heighten your sense of responsibility when you have that big of an audience. I mean, we crap on corporate media all the time. CNN, MSNBC, who has a quarter of his audience because they push nonstop propaganda. They push nonstop lies. Well, whether you like Joe Rogan or not, and I like some of his stuff, if you're a viewer who can't take any criticism of Joe Rogan or think he is infallible, then you're just worshiping someone. You're not actually looking at objectively. But he needs to understand that, yes, free-flowing conversation is good, but for certain topics, they're not just simply political debates. This is a life or death matter. The information that goes out there could affect people's decisions, and those decisions could result in people being hospitalized. Those decisions can result in people dying. So you have to take a much closer sense of responsibility when you have a Dr. Malone on, or when you have these other people on. It's not to have them on, but to give more time to research them, to give more time to see what are other people saying, why are other people saying they're quacks, to look into their claims. And you might not have the expertise to knock down everything they're saying, but from the way he describes it, he makes it sound like, yeah, I'm just having conversations and they're very free flowing. And, I don't always, it sounds to me what he's saying is I don't really prep that much because I want it to be, free flowing and authentic and stream of consciousness or whatever. That's fine. But when you're dealing with topics about life or death and a public health emergency, and thankfully cases are going down, you could still have that free flowing conversation, but you should be armed with data to, if Robert Malone is trying to say that, vaccines are hurting people and this and that, you should do the research and have the data to push back. So to me, I don't think he should be removed, but I don't have a problem with people canceling their Spotify memberships, just like I have no problem with people going after, Fox News advertisers over the crazy white supremacy Tucker Carlson puts out there. I'm not saying remove Tucker Carlson, but there are some very thin lines where Tucker Carlson is saying things that to me are inciting violence. But I have no problem if Tucker Carlson, he should have freedom of speech to say what he wants. But if people want to take actions to hit Tucker Carlson's advertisers or hit Fox News where it hurts because of what he's saying, I don't have a problem with that. So you could have freedom of speech, but that doesn't protect you from any freedom of consequence or pushback or being, affected or having consequences for if you're putting out stuff that is wildly flying in the face of actual data and science that could get people killed. And by the way, this goes back to the old thing where cable news producers and bookers, they always were trying to book people on the other side of the climate debate, right? Because, we got to have a debate and we have to have the other side. But eventually they stopped doing that because people were saying some things don't have two sides. Some things are just based on science. Some things are just based on what's right in your face, which is global warming and the climate inferno. So for COVID, there are some things that I think are open to debate, whether we should have vaccine mandates, government mandates, how stringent should we be with masks? Where should people have to wear masks? What kind of masks? I think those things it's fine to have debates on those. And I think for some of them, there are valid differences in opinions. But there's at this point, and I will not bother anymore. I've wasted too much time addressing anti-vaxxers. If you still don't believe in the vaccine, regardless of how much data there is right now, showing that the overwhelming majority of hospitalizations and deaths are unvaccinated. If you're still like, I know you are, but what am I? And you're denying that, then I cannot, you can't talk to brick walls, and you can't talk to people that, don't want to, facts don't matter. And they just, for whatever reason, whether it's paranoia or conspiracy theories, don't want to believe those facts. I'm not wasting my time. But with that said, I hope, and some of the things Joe Rogan said, he's a comedian, Jordan. You don't go to a comedian for news or guidance or on health issues, not if you have the brain cells still working. See, that's the thing. You would think that people aren't watching Joe Rogan and then making decisions based on what Joe Rogan says. But unfortunately, and I can tell you, not just with Joe Rogan, across the board, too many people in this country on the right and the left, they do make decisions, and their thought process on everything from a deadly virus is heavily influenced by Joe Rogan or Tucker Carlson. I mean, that's the sad truth. So like normal, more educated people would be like, yeah, I like Rogan. I like Rogan for other things. I'm not going to Joe Rogan for whether I should take the vaccine or, make decisions around COVID. But unfortunately, that's not how it is. There's a huge, huge chunk of Joe Rogan's audience and other audiences that are actually making their decisions and being influenced by Joe Rogan. So my whole point is multiple things could be true. I don't think he should be removed from Spotify. I don't think he should be censored. I don't believe in that. But he should be more responsible with the things he says. So I wish way back when he was talking to that person and saying to a 21-year-old, when he said, if you ask me, should you get vaccinated? No, I think the more responsible thing that he should have said is, you shouldn't be asking me. I mean, me personally, if I was 21, would I do it? Probably not. I believe in a healthy lifestyle, this and that, but I'm not a doctor. I'm not a medical person, so I don't want to give you the wrong advice. That's the more responsible thing that he should have said. So it's not like, and when he says, again, in that statement of what he said, I think, well, you have 11 million listeners. You could provide whatever you think about a whole lot of other things. But on a deadly pandemic, Joe, and not just Joe, to other people, I would hope you would have a little bit more responsibility and you would take a little bit more seriously that people watching, they're not just watching for entertainment. A lot of them are going to actually get influenced by what you're saying and then take action or inaction based on what you're saying. So hopefully it gets to a point where he says, honestly, I don't know enough about it. I don't think there's enough data about it. So go talk to your doctor. If it were me, 21-year-old Joe Rogan, and I was 21-year-old Joe Rogan, me personally, I don't think I would do it. I think, I would take my chances. I'm healthy. I'm young, this and that, but I don't want to give you medical advice. That is the responsible thing to say. So anyway, that's what I think. If I lose people, I lose people, but I'm not going to cherry pick what I think. Jordan, I think you're belaboring this issue. Hype to increase your viewership, which is okay by me to some extent, but I don't think you have the proper footing to be lecturing. If I was trying to increase my viewership, trust me, I would have actually put in the headline and the thumbnail Joe Rogan for the live stream. Trust me, it would have probably doubled my viewership. But instead, I put in the headline the vote for single-payer healthcare in California, which suppressed the viewership. So you have it backwards. I mean, we'll probably cut something from this and post it tomorrow on Rogan specifically. But trust me, if I wanted to juice my viewership and audience, I would have led with Rogan, and that would have been the videos, the live streams image, and it would have been in the headline. So you're wrong. Anyway, so that's all I got on that. Thank you for watching. I'll probably have an update tomorrow on the CalCare vote to see if it passes. At this point, I don't know live if it's being voted on right now, but it should be voted on in the next hour or two. So if it passes, maybe we'll have Amar right back on to talk about what happens now if it passes. If it doesn't pass, we'll cover that too. Tomorrow I'll have Steve Grumbine on, which we have on every Tuesday. Thank you for watching. As a reminder, sign up as a Status Coup member. We have a lot of momentum going on right now as far as membership. So definitely consider signing up. We just got another member. Jesus just signed up. So that's 1, 2, 3, 4, 5, 6, 7, 8 new members just today. So maybe we can get to 10 today, hopefully. And let's continue signing up more members, because if we could keep signing up new Status Coup members, that is how we're going to be able to expand the team, hire more freelancers, and hopefully be able to fund more on-the-ground reporting. Unfortunately, I can't print money in my backyard. I'm not the Federal Reserve, so I need viewers to fund this. So please, if it's within your budget, $5 a month, statuscoup.com/join. You don't have to agree with every single opinion, but hopefully you appreciate the investigative reporting we do. Hopefully you appreciate the on-the-ground reporting that we do. This whole idea in the progressive movement, I'm unsubscribing because you have an opinion I don't agree with. We need to stop that bullshit. You don't have to agree with every opinion of mine or other shows. Your membership or whether you're a subscriber should not hinge on whether you're in complete agreement at all times. Your membership or YouTube subscribership should not hinge on whether you're being fed what you believe 100% of the time. Enough. You don't have to agree with my take on Joe Rogan or on all things to support actual journalism, to support investigative reporting on Flint and other things. We're not children. And this mentality has gotten worse on YouTube over the years. I'm taking my ball and going home because I don't like your opinion on this video. And it's stupid. It's really stupid. Don't get to the mindset where you just want to be in an echo chamber and watch stuff that validates your opinions 24/7. That's not a good mentality. You're not actually learning anything that way. You're just going to an online pep rally. So anyway, thank you for watching. I will see you tomorrow. By the way, we are live at 5 o'clock Eastern time going forward. Live at 5 o'clock Eastern time, 2 o'clock Pacific. So we did 6 o'clock for a little bit. Now we're going live at 5 o'clock Eastern time. So make sure, put it in your pipe and smoke that. 5 o'clock Eastern time tomorrow and every day from there. Thanks.